you've probably heard a lot about quarantining and isolating as we talk about staying home to avoid spreading the virus. It's easy to get the two of them mixed up. So today I wanted to talk to you about what each of those terms actually means and how it could apply to you. First, let's talk about quarantine. Quarantining happens when you might have been exposed to the COVID-19 virus, but you have no symptoms. While in quarantine, you need to stay home. You could be infected and you could spread the virus even if you don't feel ill at all. You could feel fine and still be contagious. You really do need to stay home. You'll be asked to quarantine if you've had contact with someone who has a known case of COVID-19. Here are some other cases in which you would also need to quarantine. First, if you were within 6 feet of someone for at least 15 minutes over a 24-hour period, if you care for a person who's COVID positive at home, if you shared dishes, cups, forks, spoons, or other utensils with that person, if that person coughed or sneezed on you, or if you touched, kissed, or hugged that person. You may also need to quarantine after traveling out of state to or from an area where coronavirus is spreading rapidly. So if you take a trip to Texas, you'd need to quarantine for 14 days when you return home. A quarantine usually lasts for 14 days after the last contact with an infected person or after arriving home from traveling. So if you're quarantined, this doesn't mean that this is a good opportunity to go run those errands that you've been putting off or to go visit with friends. If you're quarantining, you need to stay home. You need to stay safe. You need to keep your friends and loved ones safe. Make sure that you're isolating yourself and not getting anyone else sick, just in case you could actually have COVID-19 but not have any symptoms. So let's talk about isolation. This is when someone who's actually infected with the virus and is contagious needs to stay home. So quarantine means you may not have the virus, but you stay home. Isolation means you do have the virus and you must stay home. This prevents the spread of the disease to other people. A person should isolate when they have symptoms of COVID-19 and they've tested positive for COVID-19, even without symptoms. Isolation lasts for 10 days from the time you had your COVID-19 symptoms or when you took that test, if there's any question. After that initial 10 days is over, you should have 1 full day without fever, that's no fever, without any medications, before you stop isolating. So if you start off quarantining and then you start to feel ill, you should switch to isolation and add an additional 10 days from the onset of your symptoms. We absolutely know that this is hard to do. It's inconvenient and sometimes it can be very difficult and have impacts across a range of domains within your life. But this is necessary, and it's an important step in stopping the spread of COVID-19. This is a very contagious virus that's, again, ramping up in our community. We need your help. Your individual decisions will be what brings this disease under control in our community. We're counting on you. Thank you.